Hello, everyone. It is my great pleasure to welcome you to today's webinar, the Vithoulkas Compass demonstration using real-life cases with Andrew Ward. My name is Dr. Lefteris Tapakis, and I'm a part of the Vithoulkas Compass team. This session is being recorded and will be uploaded on YouTube later. Andrew Ward needs no introduction. He's a very busy practitioner in UK, London. He's a diploma holder of International Academy of Classical Homeopathy, and he's an excellent experienced practitioner. Today, Andrew will present us a case of gallstone with cholecystitis, treated with classical homeopathy with the help of Vithoulkas Compass. If you have any questions, please put them on the chat and we will try to answer them in the end. Dear Andrew, the floor is yours.
Thank you very much, Lefteris. Welcome everyone to this next webinar in our series of working on what works in homeopathy in collaboration with Vithoulkas Compass. Today, I will present an older case of mine of gallstones, obstructed bile duct, and cholecystitis treated with classical approach. Okay, let me share my screen with you. So, the interest of this case, apart from the pathology and how well this patient did, is to show the differential between Chelidonium majus and Lycopodium. Two remedies well known in this kind of pathology, but very similar remedies in many ways. So this is a good case to show what the differential is between these two. So this case goes back quite a few years. 2011, 59-year-old female presented with severe jaundice and episodes, attacks of gallstone colic, which were worse for consuming fats and particularly cheese. 1 month previously, she'd had another attack with pain and vomiting. And this was triggered by doing one of these trendy liver flushes that you see online now, and colon cleanses with a magnesium compound. These liver flushes, I believe, can be quite dangerous. They can be forcing things in the body, so trying to force gallstones out of the gallbladder. And this happened to trigger her problem here and led to severe attack and severe pain in the gallbladder. Very dark yellow urine and jaundice, yellowing of the skin. Pain in the right hypochondria, extending back to the back and to the right scapula. Pain worse lying on the right side. Nausea and complete lack of appetite. And clay stool, meaning clay-colored, grayish, light-colored stool. So she obviously had her ultrasound test, and they found that she had a blocked biliary duct, the gallstone. this is quite a potentially dangerous situation if it's not dealt with fairly soon. On my research, it's something that can be potentially fatal if it's left too long, or can lead to various other problems like pancreatic cancer and things like that. So blocking of the biliary duct leads to a buildup of bile and yellowing of the skin due to increased bilirubin in the skin. Usual causes gallstones. Risks are high, can lead to chronic pancreatitis or cancer. If blockage is not removed, can lead to a life-threatening infection and dangerous buildup of bilirubin and liver disease. So, of course, surgery was suggested to her and removal of the gallbladder as well. She refused this option and then came to see me. General symptoms. Cheese was something that she loved very much, but was very bad for her gallbladder. And there was a very strong craving for sweets. Now this, from the notes, she'd said that this was a relatively recent craving in the last few weeks. Her story in the background to this problem was that she had a problem marriage. Her husband was having an affair with a friend. So, and she knew about this for some time. So she then left him with the children and moved to another area. She said, I remember a comment, "I don't hold back when angry, always been independent." She became very suspicious and checking his things. Then he had another affair. So then she moved again. And there was a lot of stress because they had I remember a business together. Feels strong sense of injustice about what happened and anger. Family history, interestingly, the father had cirrhosis of the liver and jaundice at 52. So there was some predisposition here for where this problem may have occurred in her under her current stress, emotional stress. So the initial analysis a case with 11 symptoms here. So I've put in here this symptom, ailments after mortification for emotional state, the indignation and the anger, gallbladder stones, the gallbladder pain, so the right hypochondria pain extending to the back and extending to the right scapula. Very specific rubric, this, that is very specific to gallbladder pain. And we see here the main remedy is chelidonium. So we then have pain, colic. So this is the gallstone colic from the problem. The pain was worse lying on the right side. And here we have all the degrees that these symptoms are in. We can change here on Compass the degrees very easily. And urine, very dark, dark yellow. Here I've combined these two rubrics. Sometimes we can do this to gather more remedies within forming like one rubric, if you like. This can be done easily under options here, where you see merge symptoms. Oh, can't. Okay. But anyway, you get the idea. merge symptoms, and then you get a choice which symptoms to merge, and then you can put them together. Sometimes useful if there's a rubric that has very few remedies in, so you can bring some more remedies in with a similar rubric. The jaundice, discoloration, yellow skin was very strong. Desire for cheese. And we see the remedies. Fat aggravates. And desire for sweets, which was quite strong. So this is a nice totality of her case. We'd say we've got symptoms on different levels here: general symptoms, physical symptoms, and mental emotional symptoms. So the initial result we see the system tells us the result is clear. Based on this information, Chelidonium majus is the first remedy. So we can have a look at why. It shows us that there are 8 out of the 11 symptoms. That's a pretty high score, with these ones in red being very highly important. So as we saw, pain extending to right scapula is in high degree in Chelidonium, and also just extending to the back. And then it shows you here which symptoms are not present. So we've got 3 symptoms. It doesn't have the mortification or the worst lying on the right side, all the fat aggravates. And then we have lycopodium next, also at 8 out of 11. Slightly different. We've got 3 symptoms missing as well. It's not in extending to right scapula or desire for cheese or fat aggravates either. They're very close remedies. What you can do at this point on this very clever system is say, oh, I don't know, which is it? So there are various options you have here. You can look at Materia Medica directly. Is that going to open? Yes. And have a look at the Materia Medica. And maybe this will prompt you to ask some more questions. Okay. And the other option here is the differential analysis. It's a very clever part of the program, which it does all the hard work for you and brings up quite a few symptoms that you may not have thought of that relate to the top few remedies that you can then ask the patient to see if it will confirm either of these remedies. So we see here there's quite a few mind symptoms and generals, just to see if something will clinch the remedy. So here we've got weakness of what was about to do. There's also a Chelidonium symptom. And then we all know the afternoon aggravation of lycopodium, etc. Warm drinks, of course, we see that in both remedies, so not very helpful, etc. So it's very useful, and you can add a few things here, and it might clarify the remedy for you. Also, you have another option down here for then of main keynote symptoms of all these top remedies. So you can have a look at chelidonium. And it will bring up some more keynotes of chelidonium that you can also ask. Some things you may not know. So again, about the urine, is it only dark in the morning? Is there back pain, stooping? Or do they feel better eating after midday? Etc. So it's another option. And some other things here, which I won't go into yet. But so there's various components here that you can start to differentiate your remedies. In the end, the process of repertorization is only giving us a guide. It's not necessarily going to give us the answer. It gives us a guide to the main remedies that we need to differentiate in Materia Medica. So we either, with our own Materia Medica knowledge, we can differentiate ourselves, which is why, the great homeopaths always had tremendous Materia Medica knowledge and would be able to differentiate with the patient. Or it's something that you can go to the books and have a look and see some of the information that you don't know. So let's go back to the symptoms. So I gave chelidonium based on this repertorization. The fact also that she said that she didn't hold back when angry and she's been independent. With chelidonium, we know that they're quite a strong characters, strong opinions, say what they mean what they say. Lycopodium tends to be a bit more on the cowardly side, so putting this together with strong symptoms seemed like a chelidonium case, but very specific to gallstone problems. So I gave 30C. This is very this is a very acute situation, really. Actually, it wasn't 2 weeks, it was 1 week here. Let's change that. So you don't want to wait too long in a situation like this with a blocked bile duct. You want to see some effects very quickly. You wouldn't want to say, I'll see you in 6 weeks. Could be very serious. So within a week, you need to know what's happened, even a few days. So I saw her a week later, and she said, no effect at all. It's exactly the same. So, okay. Back to the drawing board. I had a look at the symptoms. They were all the same. But when I questioned her further, it seemed like the sweet desire was something stronger and more recent. And it's always important to take note of a recent symptom, a recent change. So this gives it a bit of a higher priority. So I put this number up to a 3 underlining with the desire for sweets. And apart from that, I think everything else was the same.
Andrew, did you give the chelidonium 30 once or repeated doses?
It was, good question. Let me see, I didn't put it on there. I gave some repeated doses. So she was taking it daily, once a day.
Okay.
So no effect from a daily dose.
Mm-hmm.
Yes, important. I think in this situation, you can repeat the remedy. It's quite acute. So where were we? Yeah, so there's some slight changes in this repertorization, but not much. And we still see its top, but here we have it saying it's now moderately clear. So there's some doubt now, because we've changed one thing, which is the sweets. And so, having had no effect from the chelidonium, I went on to give lycopodium 30C again daily. Of course, daily with the proviso to stop if there's any aggravation. Always stop if the symptoms aggravate. After the lycopodium 30C, she had an aggravation of the pain after the second dose only. So then stopped. Let me get the history up here. Aggravation of pain in the right hypochondria with tiredness and nausea. And then by midnight of the same day, the pain had disappeared completely. She had some pain all the time, and then she would get these severe attacks with vomiting, and so she felt a worsening of the picture with nausea, and then the pain disappeared by midnight. And by the Sunday, that was the Friday, by the Sunday felt normal again, she said. Skin was much less yellow and the urine lighter. So the blockage had obviously gone. So I said, wait, let's wait. Seems like that's going in the right direction. And we didn't hear anything from her then for 2 months. I followed up. And she said, yes, the skin is much less yellow. Some itchy blisters came up on her fingers, which are better now. So here we see the nice direction of cure. Internal problem coming to the surface after 2 months with the skin eruption, which went by itself. Feels hungry now, no nausea anymore. Can even eat meat and cheese now with no problem. She was very happy about. So this was the, description was like a podium. So we see results. So you can see that the lycopodium, as we've said before, very similar. Both had 8 out of 11 symptoms. Here we have some metadata. This is just extra information that Compass puts with Materia Medica. And here you see lycopodium and chelidonium both like sweets, but in lycopodium the desire is stronger. So she had a strong desire that developed, and it was recent. So it pointed it in this direction, actually. Now this bit of information is actually more reliable than what you might call the more personality symptoms, where we have this idea. If we have a look at the Materia Medica of chelidonium, we see here it says powerful, domineering, wants others to listen, runs their lives. So they're very strong individuals. Whereas if we see lycopodium, we see the idea of cowardice, with feeling they want to hide their how they feel inside and this kind of thing, although they can be quite harsh with their loved ones. So these kind of things are unreliable as information, actually, because we're talking about individuals with all sorts of different shades of personality. So we can't use these as things that actually confirm remedies, in my opinion. We need more factual-based things. And the sweets is something very important because it was recent and it's strong. And it's much stronger, and you see chelidonium here has desire for sweets, but in the first degree. Whereas lycopodium, it's, as we know, it's third degree. There's chelidonium and there's lycopodium. So there's a big difference. And this is a piece of factual information. Yes, metadata. So it talks about the sweets. That's the same, I think. Yes. So moving on from here. She was then fine, and I didn't hear from her again until 5 years later, 2016. And she dropped me a line and said, "It's been a while since you cured my gallstone blockage. Absolutely perfectly. Thank you again. I've had no trouble at all since." And then she wrote me a testimonial, very useful thing to get from our patients. And she wrote this in a cancer blog, and she gave permission for me to publish this. Because this was a blog about a particular boy who developed pancreatic cancer after having had a blocked biliary duct. So she said, "I know this is a cancer blog, but my experience may help someone reading about their ill symptoms before being diagnosed. His pancreatic cancer were identical to mine 6 months ago. I knew I had gallstones, which had been kept in check with diet for many years." She'd had this problem as a sort of simmering problem for years, but diet had always kept it stable until she had her emotional stress, you see, and then with the anger, we always associate anger with the gallbladder and bile. People get bilious with anger, and it starts flaring up. In addition, I was doing liver flushes. After one of these, I suffered what seemed to be a gallstone attack or colic. I recognized it easily as I'd had many. I was in agony for 3 days, but refused to go to hospital because I knew they would remove my gallbladder. On the 3rd night, I had a dialogue with my body, or blackmail: either stop the pain or I'll call an ambulance. 3 hours later, the pain had gone. End of story. No way. I developed full-blown jaundice, yellow eyes, brown urine, clay stools, fatigue, no appetite, depression, verging on suicidal thoughts. The only thing I knew to try was detoxing with juices, using everything I'd learned about aiding the liver, also a tonic. Meanwhile, everyone was urging or begging me to go to the doctor, which I refused to do. I haven't seen one in 20 years. And of course, many just threw up their hands in despair, waiting for me to deteriorate even more. Then I would probably collapse and the hospital pick up the pieces. After 5 weeks of not getting better, I made an appointment with the homeopath myself. It was obvious to him I was ill, but he didn't judge or panic. He listened to my story. Lots of hidden anger, resentment, and feeling helpless about others' plights. Lack of confidence. So this is something she hadn't particularly mentioned to me before, but we see how that fits in with the lycopodium now. It's not something chelidonium suffers from. Lycopodium has a lack of confidence. pretending to be always cheerful when I was far from it. We discussed possible blood tests or scans to see where the blockage was, but that meant going to a GP. Okay, we agreed, not a good idea yet. Actually, she did go and have her scan, and we found the biliary duct blockage. He gave me a week's supply of chelidonium. Nothing changed. Back again, he gave me 4 pills of lycopodium, warning me they were powerful. I don't remember saying that. I took 2 that night and 2 in the morning. Nothing happened. Then the day after, I had really bad pain, getting worse as the morning progressed. I texted the homeopath, who said, good, keep me posted. I went to bed feeling like I was in labor, slept, didn't eat at all. Then by midnight, the pain had disappeared. Next day, I was exhausted, stayed in bed. The day after Sunday, I cannot tell you how wonderful I felt. Normal hunger, energetic, happy, excited, unbelievable. Yet always a bit wary it wouldn't last, but it did. This was 4 months ago. Jaundice disappeared slowly. Everything returned to normal. And I honestly felt 110%. Anyone who's been ill will recognize the euphoria. The family were dumbfounded. They just said, oh, well, whatever it was, you're better now. Or, oh, you went to the doctor. No, a homeopath. A miracle. I think it was a combination of everything, but the lycopodium was the right remedy for me this time. I cannot thank the homeopath enough. He was positively beaming, meaning happy, when I went back to follow up 3 weeks after. Today, after reading about Emil, I wonder if this may have led to cancer if treated differently. So this was very nice testimonial.
Excellent. It's great
Now,
when we have such feedback from our patients.
yeah, straight on the website. And what's interesting, she came to see me last year again. So we're talking 2015. When was it? 2016, 7 years later. She came to see me in August last year with a skin eruption. Very interesting now that with the direction of cure, she's getting skin eruptions rather than problems with her liver or gallbladder. So she'd been under a lot of stress because she had to leave Cornwall, an area of UK where she'd been living for 7 years. Had to sell the house. So big stress. She doesn't know where she was living. She hadn't bought anywhere. And so this time she came up with a skin eruption all over her ears, temples and face, red and itchy, a bit like hives, really, or urticaria. Eruption worse for heat, worse at night, better cold applications, putting ice, cold packs on it, and with swelling, red swelling. So it's a very, very obvious picture of apis. Gave her 3 doses of apis 30C, and 2 weeks later, much better since the remedy, almost gone after the 3rd dose. And 2 weeks later, eruption's gone, feeling good, has rented a house. So all in all, a very good outcome for her with homeopathy. Seems to work very well. And now, she's reached a better level of health now under extreme stress again. She just came up with urticaria rather than gallstone blockages. So I just wanted to have a look at, as I said, a differential between these 2 remedies, because they can be difficult to decide. So I said here, remedies have many similarities and some characteristic differences. Both remedies have an affinity with the liver and gallbladder. Both are right-sided. Both have biliousness with eructations and indigestion. Both have pain in the right hypochondria extending to the back in the 3rd degree, which is typical of gallbladder pain. Both desire and are better for warm drinks. Both have right shoulder pain, which is often another sign of liver issues. Both can have one hand or foot colder than the other, which is a peculiarity symptom we know of chelidonium, but lycopodium, but chelidonium also has it. They can also both like sweets. Put that in there. But chelidonium, what we see there, time-wise, they're generally worse at 4 a.m. or 2 to 4 p.m. and their key times. Whereas we see in lycopodium, worse is at 4 p.m. or 4 till 8, and then better in the evening. So this is a very clear distinction between the two, 4 a.m. and 4 p.m. Chelidonium often has facial neuralgia with their liver symptoms. You'll see those two things together often. We see this symptom here, I showed you, only has chelidonium, which is extending to the right scapula. Now, whereas this we see extending to the back, where you see lycopodium in the same degree. I don't know how useful this is really, because this is the bigger rubric. It's extending to the back anyway, the scapula. So, but anyway, that's one thing we see a difference with the scapula.
Yes, and we have a comment about this, that in abdomen pain extended to scapula on only 5 remedies. There is no lycopodium there. Can you comment?
This one, they're going to the scapula. Yeah, I would say
abdomen pain, yes, abdomen pain, I think, right. Yes, that
yeah,
lycopodium is missing from this rubric.
yes.
Yes.
Yeah, I would say it should be in there, because these rubrics are almost identical, really, I would say, but this one's more specific, isn't it? And the back could mean straight through to the back, lower down, as we're talking about the scapula is higher up. So there is a difference, but I've seen certainly lycopodium also have that symptom. So I would say it could be added to that.
Okay, another question about the differential analysis is what was the differential analysis with natrium sulfuricum that is a remedy for liver and gallstones as well?
True, it is true. Well, did it come up in the analysis? No. It wasn't. Well, there it is. It's not a remedy I considered in this case, really. It has some symptoms, but it doesn't have this pain going back to the back. So all these symptoms are missing. It doesn't have the mortification, the anger, pain going to the back, or the lying on the right side, or desire for sweets. And you, with natrium sulfuricum, you would generally see depression, some kind of depression in the case. So other things, chelidonium has right hypochondria pain that extends across the abdomen. So sometimes it's not just in the right side, it can go right the way across. It's a typical symptom of chelidonium, which you can get with gallbladder pain. It seems to be not just the right, but extending across. With chelidonium, the abdominal pain is better for eating, which is not the case in Lycopodium. It's better for warm drinks and warm milk, and better for stool. Cravings for cheese, strong in chelidonium, which she had, and milk, so dairy. They like dairy. And sweets is in second degree. Coldness of the fingertips is a peculiar keynote. And we see, as we said, mentally, emotionally domineering people, but in a kind of nice way, wanting others to listen to them and give advice. Brave people, but again, we can't use this as a means to decide a remedy. Lycopodium, on the other hand, as we said, worse 4 p.m., 4 to 8 p.m. Desire for sweets is stronger. Cracked heels, that's another nice indicator for Lycopodium. Unrefreshed sleep in the morning. This is very typical of Lycopodium, not so much chelidonium. I think that's because Lycopodium affects the liver more than the gallbladder. General amelioration in the evening is typical of Lycopodium. Their abdominal pain is better for passing flatus. They get full easily, and so they're not better for eating. Sleep on the right side. Impotency, we said here, dictatorial but not brave, lacking in confidence, which she admitted to in her testimonial. Fear of people, responsibility. Quite a lot of fears, weeping when thanked, and dyslexic tendencies. So quite some differentials really, but in terms of the pathology and symptomology, they're very similar. So hopefully this helps you with some differential here to see the differences. And you know, in this case, I gave the wrong remedy initially. Wasn't chelidonium. It's okay, we can change it quickly in this kind of case. And the Lycopodium acted very fast after 2 doses. Aggravation, which we would expect to see. As it was a 30C, it wasn't severe aggravation, really severe. And then everything passed, the blockage went, and she was good after this. And it was good to have a long-term 5-year follow-up, and then seeing her last year. Everything's been good. So we're talking.
Sorry, a question that we have, Andrew, about the dosage is that after the aggravation and the resolution, did she discontinue the Lycopodium, or did she continue for the week that you prescribed from the first place?
Stopped. She stopped as soon as aggravation stopped. Yeah, have to stop. Yeah.
Okay.
Okay.
And another question about this: if we looked further down the history from current complaint to say previous episodes of illness from childhood and general behavior, would there not be more confirmation towards Lycopodium?
Probably. Yeah, I don't have that information, but I know she said in her testimonial
for the confidence.
About the confidence, and there was all the where did she say? Yeah, here we are. Lots of hidden anger, resentment, and feeling helpless, lack of confidence, pretending to be cheerful. So we see some little indications here, but we don't necessarily need to go into all that kind of psychological detail. We have enough clear keynotes. It's not necessary, as long as we can find the remedy correctly. And
Okay.
what was probably the causation?
A question about the gallstones. Is what happened with her gallstones? Any news on that?
No, I didn't have any news that she didn't go back to the doctors or have it checked again.
Mhm.
I presume it just dissolved. I mean, it's hard to, I don't know. It just, or she passed it, but it would have been very painful to pass. So it must have just dissolved. It's very strange. I know Kent, if you read Kent, I'm not sure which remedy it's under. It may well be chelidonium. But the great master Kent said, if you get the correct remedy in gallstones, what the remedy does is the organism changes the constituency of the bile chemistry, and then the stones just dissolve. Interesting. He said this. So it works from this way, that there's something wrong with the biochemistry so that stones form. And then when it gets corrected, they dissolve.
Yes, of course,
Like
this is
magic.
not always the case. In my experience, I think it is easier for the kidney stones to get to leave the organism than the gallbladder stones. I think it is more
Yeah.
difficult regarding the
Yeah.
gallstones. Yes.
I remember another case where again, it was a case between lycopodium and chelidonium, and I'd given, I think it was the other way around. I gave lycopodium, didn't work, and then gave chelidonium. She had such a bad aggravation. I think it was a 200 that she fainted and was vomiting all night. And she brought up, when she realized with the vomiting, there were all these green stones in the vomit. It seemed incredible to me that she'd passed them into the stomach. Somehow they got, is this even possible? They got into the stomach and then she brought them up. There's the little green bits in the vomit. And after this, it was a very dramatic situation. And after this, everything was good. Stones were all gone.
Great.
I don't know. It's the body finds a way to clear them. Huh? In this
Mhm.
case, I'm guessing they were just dissolved. Mm, yeah.
Okay, let me see if we have any other question. Uh, there is a question if the chelidonium helped the stones to dissolve, even if it was not the correct remedy.
Hmm. Well, we didn't see any action of the chelidonium,
Mhm,
so can't say that really.
mhm. Okay, another question is about the potency. You chose 30C because of the acute symptoms.
Uh,
Why 30?
I said, I didn't want, I'd had this experience with 200C and the gallstones before, which was very dramatic.
Mhm,
And I want to keep the potency lower because it's a serious thing and it's adequate enough 30C
mhm.
without big aggravation.
Okay. Okay, if you have any more questions, please write them to the chat in order to be answered. How was the time of aggravation?
The time of aggravation that she had. She aggravated during the day. And then by the midnight, the pain had gone. So it built up through the day. Yeah. If that's what they meant in the question.
Mm-hmm. Okay. Thank you so much, Andrew, for this wonderful presentation. It was really informative to see the differential diagnosis between these two very important remedies regarding the action on the liver and the gallstones. And thank you everyone for being with us today. If you have any questions, please, or feedback about the webinars or any proposals in general, please contact Elena Abati at iabati@vithoulkascompass.com to also get a coupon for a 20% discount or a free trial period if you don't use the Vithoulkas Compass. So thank you again. If you have any, Andrew, you have any last comment?
Yes, I think, thank you very much for the collaboration and for inviting me to do this webinar. I just wanted to say that if anyone is interested, I am running a 2-year course, which starts actually next weekend online. So I think that's something that if anyone's interested, they can contact me directly. And I don't know if everyone has my details, but
you can write your email at the chat, Andrew.
The chat, yes. Let's put the chat. Okay. This is just going to you. And can I put it into
the meeting group chat?
Okay. It says here, it's just going to you. I think we can.
If you click on it, and a drop-down list comes up, and then check meeting group. Andrew at homeopathyuk.org, huh? Somebody wrote it. Yes, you wrote
And
it.
I can put.
Okay, yes. Yes, it is visible, yes. Let me put it to everyone. Okay. Yes. And the URL as well. Okay, so thank you very much, Andrew, and thank you all for being with us today. The webinar will be uploaded in the Vithoulkas Compass YouTube channel as well, and where you can see the previous webinars with Andrew and other webinars as well. And you can also subscribe to the channel to see more videos when they come up. So thank you again. Wishing you all the best, and see you soon.
Thank you.
Bye-bye.
Thank you.
Bye-bye.
Thank you.